Hi everyone, the scene shows that Mr. Adam was concerned about reports of medication errors. He plans to implement a quality improvement program. Jay also talked about the pharmacist's opportunities in chain community practice. So, what is Continuous Quality Improvement (CQI)? CQI is a program that assesses errors that occur in pharmacy during all phases and steps of dispensing medications. It is non-punitive and seeks to identify weaknesses in processes so that appropriate corrections can be made to improve them. To implement CQI, there are several steps. First, the quality-related events should be documented. Next, appropriate action should be taken to prevent or minimize the patient harm. A meeting is then conducted and a summary of all recent quality-related events is made. The summary is then analyzed to decide on actions to prevent future similar mistakes.
As the pharmacy has not conducted CQI before, they could begin by first having a team meeting to explain the program, goals, and the fact that the program is non-punitive and participation of everyone is encouraged. The focus of the review should be limited for the first few meetings and be kept to focus on just one or two areas as to not overwhelm everyone. As the staff sees the focus is on corrective processes, they will become more interested.
Now, moving on to our suggestion on improving medication safety in our community pharmacy. The first suggestion is to train staff on assessing simple medication history taking. This includes indication of both prescription and non-prescription medications, previous medication use, and history of food or drug allergy. This is to assess whether the medication is appropriate for the patient's condition and to help distinguish medication with similar packaging and look-alike or sound-alike names. Next, we need to educate all staff about new drugs products coming to the pharmacy, including indication, dosage, and side effects. And we also need to update them on recent discontinued drugs that are being taken off market so they can alert the customer that are still using those drugs. We should also instruct all staff never to use error-prone abbreviations or error-prone dose designation and drug name abbreviations when writing oral prescription or patient medication label. This error includes using trailing zeros, lack of leading zeros, and illegible handwriting such as cursive. In addition, medicine product arrangement should be done in a constructed manner, and ambiguous or unsafe stock bottle labels should be reported to the manufacturer. The arrangement should be based on alphabetical order and avoid arranging products with similar packaging and look-alike or sound-alike names side to side to prevent dispensing wrong medication. All stock bottle labels must have appropriate information to prevent mix-up.
Okay, now let us look at the potential challenges faced by the community pharmacists. First, one of the challenges would be the competition with other pharmacy outlets such as product price comparison or attracting customers. Secondly, another challenge is the difficulty in attracting new customers and expanding current customer base. Thirdly, it's difficult to sustain the business solely based on medicine sales due to low margin of profit and competition. Next, pharmacist's role may not be performed completely in retail setting as the focus usually placed on the sales of OTC or supplements. Moreover, pharmacists may feel challenging to educate staff on the medication knowledge or newly implemented technology like stock counting system. Then, pharmacy also may have operational challenges such as cash flow management and staffing issues. Next challenge will be the difficulty to fulfill every customer's need and demand due to limited operational funds. Furthermore, pharmacists may have a hard time to understand the actual medicine needed as customers usually describe with the appearance such as shape and color. Legislative issues like absence of dispensing separation leading to lack of prescription for the pharmacist to dispense. Pharmacists may feel challenging to prevent any errors during dispensing, especially increase in the prescription filling during the peak hour. Moreover, pharmacists may also have difficulty to provide counseling or education during peak hour as well.
Now we continue with opportunity. In general, there's satisfaction in helping general community in their health-related issue. Other than that, having a pharmacy is also able to provide job opportunity for the increasing number of pharmacists. And it will be a great platform to gain knowledge and experience by the new pharmacists and those who may own a chain pharmacy in future. Customers also prefer to go to a pharmacy rather than clinic or hospital for minor illness or inquiry because it is time-saving and the service will be free of charge. For profession-related opportunity, it includes provision of adequate and tailored monitoring or follow-up for chronic disease patients who go for medication review. Moreover, pharmacists are able to identify the possible medication error before symptoms manifest and eventually reducing the overall healthcare costs. Pharmacy also able to advise and provide information about diet, exercise, stress management, durable medical equipment, and home healthcare supplies. Last but not least, community will be more accessible to healthcare service and education.
Thank you for watching.